Hi, my name is Jeanette Spreadborough. I'm a doctorate nursing student at Gonzaga University located in Spokane, Washington, and I'm in the family nurse practitioner program scheduled to graduate spring of 2022. I have been a registered nurse for 20 years with extensive experience working on ICU units with cardiac heart failure patients. I have also held the role as a hospital administrative nursing supervisor as well as a nursing manager during my 20-year career as a nurse. In this YouTube video, I am speaking to the Idaho Legislative District 3 representatives, Bob Nannoni, Republican of Coeur d'Alene, Ron Mendiv, Republican of Coeur d'Alene, and Don Cheatham, Republican of Post Falls. My policy/bill proposal is to have Idaho pass a bill to support funding for mental health collaborative care models at ambulatory heart management clinics. Grant funds from H.R. 1222 Congenital Heart Futures Re-authorization Act of 2017 can help support funding for my mental health collaborative care models in management clinics, starting with management clinics in Coeur d'Alene. H.R. 1222 supports the CDC's work to improve the health of individuals living with congenital heart disease and heart failure by the appropriation of a total of $20 million of fiscal year 2018 to 2022. Since the federal government works in partnership with states to address mental health, I am requesting you as the legislative representatives for District 3 in Coeur d'Alene, Idaho, to request a bill that the state of Idaho will help fund mental health collaborative care at heart management clinics. Funding for the new mental health collaborative care models can be requested by grants through the CDC to access funds from H.R. 1222. The policy developed because there is an identified gap in practice for depression screening with follow-up management for patients seen at heart failure clinics. The lapse in depression screening patients at the clinic is related to an inadequate referral and follow-up process to patients, primary care providers, and other mental health care providers. Once identified at risk for depression, the heart clinic provider is obligated to help the patient make a referral for mental health evaluation. Depression in patients with heart failure complicates management of heart disease by worsening cardiovascular risk factors and decreasing adherence to healthy lifestyles and medical therapies supported by evidence-based practice. The United States federal government works with states to address mental health by helping to regulate the Americans with Disability Act, the Rehabilitation Act, the Mental Health Parity and Addiction Act, and the Affordable Care Act. Collaborative care models are cost-effective models that provide a strategy to deliver mental health and medical care for persons' mental health conditions served in ambulatory and primary care by implementing a team-based intervention of organizational leadership support, provided decision support, and clinical information systems, as well as engaging patients in their care through self-management support. The key elements of the policy would be to pay for heart management clinics to have a trained care manager on staff to coordinate the mental health collaborative care model. The policy would require the heart management clinic to monitor and track data to be reported to the CDC to track the improvement in depression screening scores for those patients identified at risk for depression. There is evidence to support the policy. The United States spends more on health care than any other country, with costs approaching 18% of the gross domestic product, with approximately 30% of healthcare spending considered waste and failure of care coordination at a cost of $27.2 billion yearly to taxpayers. Integrated team-based care is superior to traditional management care for patients with complex mental illness and chronic medical diseases, supported by research of over 30 years of integration of mental health professionals into primary care offices. Mental health collaborative care models are supported by recent systematic reviews that they are cost efficient for primary care practices to improve mental and physical outcomes for a range of mental health conditions across diverse populations in primary and ambulatory care settings. Thank you for considering a bill to support funding for mental health collaborative care at ambulatory heart management clinics throughout the state of Idaho, starting in Coeur d'Alene. Thank you very much.